New NHS statistics then say 5,074 people were in hospital in England with flu on the 29th of December. That's 4 times higher than a month before on the 29th of November. The average number of flu patients in hospital each day last week was 4,469, and that is 3.5 times higher than the average for the same week last year. More from our health correspondent, Ashish Joshi.
Am I OK to do your observations?
Yeah.
Sarah didn't think she'd live to see the new year. She has blood cancer and a compromised immune system. Around Christmas, she caught flu.
I was pretty sick. I was scared this time because I've had pneumonia before, but it's fine. And illnesses, but this was so different, this way.
It sounds terrifying. Potentially, you thought you could have died.
At the time, yes, I did.
An earlier flu season than last year and a slow rollout of the vaccine has resulted in a perfect storm, leaving respiratory wards across the country struggling to cope.
Patients who have underlying respiratory disease, who I look after all the time, they've been more affected this year and have been more likely to end up in hospital, to need our care because they require oxygen and the extra treatments that we can give them. But it's also affected people that are older that don't have underlying respiratory disease. And while those patients sometimes do end up in hospital, there have been more of them this year.
The impact of the flu surge is being felt all over the hospital, including here in the emergency department, where every bed and every bay is taken. The delayed discharge of medically fit patients adds to the pressure. There were nearly 11,000 stuck in hospitals over Christmas.
This is our discharge round. It allows us to move patients here who are getting ready to go home or ready to go home that day. It frees beds up on our acute wards for patients who are awaiting admission normally from the emergency department.
That's still a big problem, isn't it, delayed discharge?
Yeah, absolutely. We've often got people who are ready to either go home or be cared for in another setting and don't need to be in the acute hospital anymore. So having an area where we can start to move those patients through on the next phase of their journey has been really helpful for us.
Yeah. The government has announced an independent cross-party commission to try and modernise the social care sector.
The winter crisis we see in the NHS is exactly why we need to grasp the nettle of the big long-term reforms to social care that's needed, because as well as our 10-year plan for the NHS and all the reform we're doing there, we also need to reform our social care.
But findings from previous commissions haven't been acted on, and there are concerns a new report will mean comprehensive reform won't start before the next general election. You can't fix the NHS without fixing social care, and what this winter crisis has shown yet again is if there's a surge in cases or infections, then there simply isn't enough capacity in the system to deal with it. That's why the government is being urged to do something about social care sooner rather than later. NHS England has warned that the surge in flu cases hasn't yet peaked, and this weekend's extremely cold weather could mean the worst is yet to come. Ashish Joshi at the Kingsmill Hospital in Mansfield.